So, if you haven't heard in the news, the DEA is considering rescheduling cannabis from a Class 1 to a Class 3 drug. And a lot of people are very excited about this. However, not everyone is. Dr. Nichol has some secondary thoughts about the whole thing, and he's going to join me here. Thank you for joining us.
Well, of course, Sam, where else would I be? Right here. Well, Ian, you're right. It was on May 21st that the Department of Justice published in the Federal Register. If you've never seen it before, this is the book that pretty much controls all of your life. The Department of Justice, Drug Enforcement Administration, said that they are proposing to transfer marijuana from Schedule 1 of the Controlled Substances Act to Schedule 3.
So, what is the difference between a Schedule 1 and a Schedule 3 substance?
Schedule 1 drugs are drugs that have absolutely no medical purpose, at least in the view of the government. They also are determined to have a high degree of addiction possibilities or abuse potential. Now, cannabis is here along with heroin, LSD, MDMA, ecstasy, as people call it. The rest of the Schedule 2 through 5, these are drugs that the FDA or that the DEA considers to actually have medical value but do have abuse potential. Schedule 2 are drugs such as cocaine, fentanyl, oxycodone, and morphine. Schedule 3, where they're looking at putting cannabis. Now, this is with drugs such as ketamine, some of the anabolic steroids, and testosterone. Schedule 4 are drugs that have an even lower abuse potential, and strangely, the DEA places the benzodiazepines such as Xanax, Ativan, and Valium here. And Schedule 5 drugs are drugs with relatively low abuse potential. Things like cough syrup and some of the anti-seizure medications fall under that.
So how does the DEA treat these drugs differently?
Well, with Control 1 drugs, the ones that are entirely illegal, no medical use, the DEA essentially, they arrest and they prosecute people for possession and use of these drugs. For the Control 2 through 5 drugs, that's a different thing. Again, these are drugs that do have abuse potential in the view of the government, but they do also have legal medical uses. In this case, the DEA controls this through regulation and enforcement of statute laws.
So if that's the case, why aren't people in jail or in prison right now for using cannabis?
Well, interestingly, it was back in 2013, it was the Deputy Attorney General James Cole issued what's known as the Cole Memo right now. And this was guidance as far as marijuana enforcement goes to the Department of Justice. This is what people have been operating on ever since as far as the cannabis industry goes. Essentially, as long as entities were engaged in a cannabis business that was legal in the state and conforming to state regulations, the DEA took essentially a hands-off approach to that, and that's essentially what people have been running on ever since. It is interesting to note that the Cole Memo was recently rescinded. Now, they're still operating as if it is in place, but that is something to make note of.
So if that's the case, then why are so many dispensaries excited about the potential of cannabis being rescheduled to a Class 3 drug?
Well, it has to do with, again, getting into the regulations and such here. You got to look at the IRS tax code. There is an IRS rule called 280E that was put in place after a drug dealer deducted his business expenses, including bullets, lookout costs, so forth, from his taxes to avoid not only going to prison for trafficking in crack cocaine, but also to avoid the tax penalties associated with that. So Congress put forth this rule called IRS 280E that anybody that is illegally dealing with a scheduled drug, such as a Schedule 1 medication, as cannabis is, they are not allowed to deduct normal business expenses. You're only allowed to deduct the cost of goods sold. There is a overlay, I think you can put up, Sam, that talks about the comparing a marijuana retailer with a traditional reseller. They both have the same revenue of $1 million, all the same expenses, spend the same on what they're selling. However, when you look at the taxable income, the traditional retailer is allowed to deduct the typical standard business deductions that the marijuana retailer is forbidden from using as an expense, resulting in a significantly higher taxable income with a tax burden, assuming a 25% thing, of twice as high as that of our traditional retailers. So you have to understand that your cannabis dispensaries are operating on very narrow margins here. It costs them a lot more to operate because they have to pay this very high tax burden. And that, of course, gets passed on to the patients and consumers.
Yeah, so amidst all of this excitement and everything, you seem to be of the belief that there might be a devil in the details. Could you kind of explain that a bit?
I think that the devil's always in the details, and often the devil's messenger boys are writing the rules and regulations. So I think it becomes important, since you have an opportunity to comment here on your position with the rescheduling of cannabis from 1 to a 3, that you should be informed about making your opinion known. Just don't say, oh, it's great you're doing that, without really understanding what that means. And in order to do that, we got to take a dive into the minutia and regulations. The first thing I think it's important, and Sam, if you put this overlay up also, this is pulled directly off the Department of Justice website here, where they talk about the DEA preparing to transfer marijuana from Schedule 1 to Schedule 3. The section that is bold and italicized and underlined, that's all done by me for emphasis, but it is an original copy. And this is the part to pay attention to. If the transfer to Schedule 3 is finalized, the regulatory controls applicable to Schedule 3 controlled substances would apply as appropriate, along with existing marijuana-specific requirements, any additional control. What they're telling us right here is that if they do move cannabis to Schedule 3, they intend to treat it just like other Schedule 3 medications are treated. And if they're going to do that, you probably should understand how they approach Schedule 3 medications.
How are Schedule 3 medications regulated and approached?
Well, there's extensive regulation, as you can imagine, with the DEA covering things. All the information I'm providing you is from both the practitioner and pharmacist manuals published by the U.S. Department of Justice. It really is an outline of the Controlled Substances Act and what you have to do to follow the statutes and regulations to properly prescribe and dispense controlled substances. They're very similar as far as the regulations go.
We're not going to have to read all that, are we?
No, Sam, we're not going to read all of that. I could just pull some little excerpts I thought were important for people to know from this, but I did want you to know the sources. First thing to understand is that you have to have a prescription for a controlled substance. You can't go into the pharmacy and just get a control-free medication without a prescription. So right away, this is putting a barrier of access for patients to obtain cannabis. You're going to have to see a doctor for a prescription for it. Now, in order for a prescription to be valid, there's a couple things here. The practitioner has to be prescribing it for a legitimate medical purpose in the course of their usual professional practice. Otherwise, it is not legitimate. They also have to be authorized and licensed in whatever location they are to practice whatever it is that they're practicing and to prescribe controlled substances, as well as being registered with the Drug Enforcement Administration to do such.
Right. And one thing I'm wondering is, this is going to mean that a patient is most likely going to have to go into a doctor much more often than a cannabis card renewal, such as in Arkansas.
Oh, yeah. Right now, people in the state of Arkansas, at least, they can be certified for up to a year at a time. After that period of time, they need to be reevaluated by a physician. It's much more different as far as when we're prescribing controlled substances. And not only do they have to be prescribed for a legitimate medical condition by a licensed practitioner and all this, there's certain elements to a prescription to make it valid. Prescriptions have to be dated and signed on the date that it was written by the practitioner. It has to have all the patient demographic information on there. It also has to list the drug name, the strength, the dosage form, the quantity prescribed, the directions for use, the number of refills applied, if any, With Control 3 drugs, you're limited to 5 refills before you have to see the physician again.
Wow, so that sounds like it would make going to the doctor's office just that is an expense.
Oh, it's a tremendous expense for a lot of people. Doctors don't work for free. We do charge for our services. So you have to go in and get this taken care of. They have to complete the paperwork on you. You're going to have to regularly take off of work to see the physician. That's an added expense, and I see it as being a barrier to care. In addition to that, Sam, I mentioned the elements of the valid prescription. How do you write it for cannabis? I'm going to write a prescription for sour tangy 14.5%, consume 0.5 grams by dry herb vaporization every 4 hours, dispense 3.5 grams with 5 refills. And you go to the pharmacy, well, not really dispensary, I guess, to get your prescription filled. They don't have sour tangy. Well, you know what? You're back in my office getting a new prescription. It doesn't really work with the way cannabis is consumed at this point in time.
So does this mean that dispensaries will turn into pharmacies?
Well, I think it's more likely that some pharmacies will turn into dispensaries because you're right, Sam. The controlled substances must be dispensed by a licensed pharmacy, by a licensed pharmacist. And that pharmacy, if they are going to dispense controlled substances, they must be registered with the Drug Enforcement Administration.
Wow, and I'm sure that this adds more cost to the patient.
Oh, certainly. Yeah, all of a sudden you have to have pharmacists are a lot more expensive than bud tenders. That's for sure.
So how does a pharmacy go about acquiring a Class 3 drug?
It's not as easy as right now a dispensary. They order from the cultivator or processor, whatever product they want. Schedule 3 drugs, though, they're under the control of the DEA, and the DEA wants to know where all controlled drugs in the entire country are at all times. In order to obtain controlled substances, the DEA is going to want to know what you're ordering, so you have to complete an archaic and very easy to screw up DEA 222 form that must be done perfectly to conform to statute. Copies of this must be submitted not just to the person that you're purchasing the product from, but also to the DA so they can keep a record of that. And, I mentioned they want to keep a record of that. The record-keeping requirements for a pharmacy that is dealing in controlled substances are very extensive as far as what the DA requires them to have access to immediately, the copies that they must maintain, and the length of time that they must maintain all of this. This, again, adds to the cost of your medication in the end.
So what's going to happen if it becomes a controlled 3 substance?
Yeah, that's a question, Sam. I see two kind of outcomes to this. There's one that a lot of people think is going to happen. A lot of people in the industry feel it's going to be this way. Now, they may be out of some inside information. I'm not, or just because that they really, really want it, need it to go that way. If it goes to Control 3 drug and they continue to follow the Cole memo guides, now, that would be a good thing. The industry would get out from underneath the IRS 280E rules, so they're going to pay a lot less in taxes. That's going to improve prices at the consumer level. That will expand patient access to cannabis as a medication. There will be a wider variety of products available as the industry has more money to spend on innovative techniques. And this would permit an adult use market for states that want to have adult use cannabis. Now, if it goes to a Control 3 drug under the statutory regulations, which is what they told us they want to do with this, that, for all the reasons we're talking about, Sam, you're going to see a drastic increase in the prices of cannabis, at least as they are used now. The requirement of having to have prescriptions from your physician is going to also drive up cost and further restrict patient access, because you'll also have to find practitioners that, in the course of their usual practice, can issue a legitimate prescription for cannabis. Many of my colleagues don't have any experience in using cannabis as a medication, and they may think, well, I don't know if I can actually issue a legitimate prescription for this since I don't know what to write you. Again, restricting patient access, the industry is going to be less innovative in developing new products. And it is important to remember that the adult use market, the recreational cannabis market, will be completely eliminated. There is no way any practitioner or physician is going to issue a prescription for recreational use of a controlled substance. Immediately, the recreational cannabis market is gone.
I know that me and you have talked about this before, and that is what we think is probably the best solution, and that would be a complete descheduling of cannabis. So why do you think that's a much better idea than, say, keeping it as it is or changing it to a Schedule III drug?
Control of cannabis reverts back to the states. States can decide whether they want to be prohibitionist, whether they want to have just strictly medical programs, mixed use, or entire decriminalization with adult use. This will permit interstate commerce finally to occur. Sam, we've read on how on the West Coast they're so oversupplied with cannabis over there with really nothing to do. It has to stay within the borders of the state, that it's very much hurting the industry. That would allow the states that have an oversupply to actually ship to states that have cannabis programs that want to accept their shipments. That's going to bring the cost of cannabis down. It will be good for the industry. It will provide access to banking and financial services that the industry does not have right now because Controlled One substances are entirely illegal. This will expand patient access greatly as far as the price coming down and more availability improves. This is going to promote innovation in the industry, resulting in a wider variety of products, and will, of course, permit adult use markets in states that choose to have some of those.
Yeah, so it sounds like you get the best of everything with that option. Well, thank you for talking with us. I know that I'm going to leave a link down below for everyone to let the DEA know their thoughts on this. We encourage you to consider it yourself.
I encourage everybody to really make your wishes known, become informed on this subject, and give a really good informed opinion in your comment to the DEA on this. This is your opportunity to make your thoughts known. They do have to read all these comments, and they do have to consider them.
For more information on all things medical cannabis, look for us on Cannabis Expert MD at cannabisexpertmd.com. We're also available on Facebook, YouTube, Instagram, X, formerly known as Twitter, and the Gab platform.